Good morning. Thank you this for opportunity. Our presentation about analysis of inhibiting factor in antenatal care ANC examination literature review. A. Background. Globally, it is estimated that 300,000 women die from pregnancy-related causes every day. Around 830 women die from preventable causes related to pregnancy and childbirth, while 99% of all maternal deaths happen in low and middle income countries (LMICs). Access to maternal health service for all women during their pregnancy and delivery is important to reduce pregnancy-related morbidity and mortality. One way to reduce mortality is to provide antenatal care ANC service to pregnant women. Antenatal care is a service provided by healthcare professionals during pregnancy, whereas ANC service provide a platform for critical health care conditions, including healthcare promotion and prevention, disease screening, and diagnosis. The method used is literature review with a literature search, both at the international and national level, which is carried out using a database search. B. Problem statement. Research problem. Access to maternal health service for a woman during their pregnancy and delivery is important to reduce pregnancy-related morbidity and mortality. Research question: how to determine the inhibiting factor for ANC examination? And this is concept research data analysis. And finally, number of review journal article are 20. Please see that. And then this is extraction of the result of studies related to a factor inhibiting antenatal care ANC examination. The table, research years, location, and title, design methodology, sample, data analysis, prevalence of ANC examination, factor inhibiting antenatal care, recommendation for overcoming and ANC screening births. Please, you can see that. And then continues. And then the last until 20. Discussion. Antenatal care includes preventive and curative care service provided during pregnancy. 20 articles were analysis on factors that influence antenatal care complaints such as maternal education level, place of residence, mother population pregnancy, woman at risk, access to ANC service, aid, parity, research to become pregnant, social support, culture and religion, knowledge, maternal autonomy, in decision making, healthcare worker, household, world index, religion, social economy, marital status, lack of access to mass media as newspaper, radio, TV, and etc. Husband education, health insurance, perception of time, and the last number of families. The result of Colola T et al. 2020 so that the education level of pregnant women the earlier the start ANC in the first trimester. The result of both studies show that women from rural area are less likely to use uterus at less for ANC facilities compared to women from urban area in Ethiopia, perhaps due to the inequalities in health facilities and women awareness of ANC service in urban and rural areas. This study was trying to assess the prevalence and determinants of ANC attendance among women in trade unions in Papua New Guinea. The study of Koala T et al. Showed that the probability of initiation the first ANC contact in the first trimester of pregnancy was twice as likely among pregnant women who had health problems with their current pregnancy than those without risk. The most report recommendation were multi-sectoral cooperation is needed. And then conclusion. There are many factors that affect the compliance of antenatal care examination, but the 21 inhibiting factor for ANC examination, the mostly popular in the research paper review. And the mother education level, plus of resistance, mother population, and pregnant women who are at risk. The most reported recommendations were multi-sectoral cooperation is needed. For example, various local officials, village, as well as ministries such as the Ministry of Labor, the Ministry of Education, the Ministry of National Development and Planning, the Ministry of Women Development and Child Protection, and the Ministry of Finance. The Ministry of Communication and Information Technology can cooperate with the Ministry of Health to active universal ANC cooperate. Other recommendation include the Ministry of Health should strengthen awareness creation about the initiation of the first antenatal care visit and family planning to prevent unwanted pregnancies in the community, especially in rural area. In addition, health workers in the antenatal care unit must deal with material conflicts such as making discussion to obtain ANC service and household. This is my presentation and thank you for attention and listening. God bless you.